Bedwetting. Sheets, wet clothes, and an embarrassed child are familiar scenes in many homes. Although bedwetting or involuntary urination during sleep is not a worrying abnormality, it can have lasting psychological effects on the child. Though the cause of bedwetting is not precisely known, factors such as the lack of development of the connection between the brain and the bladder, genetic factors, stress, and psychological tension are known to be the most common causes of involuntary urination. Other common causes include medical conditions such as sleep apnea with changes in the balance of chemicals in the brain, constipation with pressure on the bladder, kidney and bladder disorders such as infections, and some underlying diseases such as diabetes. For these reasons, in some cases, bedwetting continues until late childhood and early adolescence. Despite the high prevalence and often improving course, this abnormality brings with it the experience of shame, anxiety, and low self-esteem, and it considerably impacts the relationships and quality of the child's current and future life. For example, the affected child may avoid going camping or traveling with his friends or feeling shame, embarrassment, and guilt from being left by his roommate's sibling, and having his parents clean his clothes and bedding frequently. Although today the problem of bedwetting is often improved by identifying its causes by medical experts and using treatment methods, the process of reaching effective solutions is several centuries old. To make this issue obviously, we make art research a basis for a better complete study and examine two artworks belonging to the 18th and 19th centuries. The first artwork is a masterpiece by Hubert. Robert was a member of the French Royal Academy of Painting and Sculpture in the 18th century, and an artist of the Romanticism school. Although the fact that the Romanticism style often expresses the emotional nature of the artist in dealing with the subject, in this work of Robert, openings from the school of realism have been revealed by processing moments from the personal life of the French people away from social events in a scene with a small genre. The characters of this painting are the usual mother and her child in their daily activities. In terms of composition, this artwork shows multifaceted coherence. In a sunlit outdoor scene, the young mother spreads a sheet over a clothesline to dry. She looks at her young son while bending her head towards him. The sad expression on the child's face proves that the mother is warning her child because he is urinating while lifting his shirt. Vicinity of the boy, the stream of water that flows from the mouth of the lion-shaped fountain is a constant reminder of water flowing. Sheets, water flow, and urine flow make the three sides of a triangle that evokes bedwetting. A dog lying coldly and indifferently in the foreground next to the stream of urine shows the indifference and insignificance of bedwetting at that time. The second artwork belongs to the famous Italian artist of the 19th century, Cesare Provaggi, who created unique paintings with watercolor techniques in the style of realism. By comparing Cesare Provaggi's painting with Hubert Roberts', we find out that the importance of bedwetting has increased over time. A young mother scolds her child in a realism-oriented atmosphere inside a crowded and untidy house. While checking the bed sheets, the child's crying face, which is covered with his hands, shows his shame and embarrassment. It seems that there is no one to tell the mother, "Your child's bedwetting is not his fault or under his control," and any punishment, blame, and instilling a sense of shame in the child by intensifying his stress hurts the improvement of his bedwetting frequency and has destructive effects on the self-esteem of your beloved child.